Okay, so in this lecture we're going to go over some of the muscles that are found in the leg as well as some of the ligaments. And so the model that I have here is the leg model. And so the way I want to start off, and we want to cover some of the big muscles first before we get into some of the smaller ones. And so we'll start here at the top and then work our way down. So the first four muscles that make up the quadriceps, okay, so you have this, which is known as the rectus femoris, okay, it's straight, that's what rectus means, femoris because it's pertaining to the region where the femur is. And then you also have the vastus group, so you have the vastus medialis, which is here, and then you have the vastus lateralis, which is here. You also have what's known as the vastus intermedius, and that is deep to the rectus femoris. Okay, so those are the muscles that make up the quads. Okay, so what the quads do primarily is they help extend the knee, meaning that they'll bring the knee in this direction. So the knee would be able to come up. Okay, so we covered these. So now let's go over some of the muscles here in the back. So this muscle is the gluteus maximus, and then these are the hamstrings. So you have medial hamstrings and lateral hamstrings. So the two lateral hamstrings include the long head of the biceps femoris and the short head of the biceps femoris. The short head is deep to this. And so let me take the glute maximus off. So I'll take the glute max off, and then I'm also going to take the long head of the biceps femoris. So then what you'll see here, number 32, this is the short head of the biceps femoris. Okay, so those are the lateral hamstrings. So now let's go to the medial ones. So the medial hamstrings include the semi-group. So you have the semi-membranosus and semi-tendinosus. So the tendinosus is more thin, like a tendon, okay? And the membranosus is more flat, like a membrane. So based off of what I just said, this one that's here in the front, that's more slender, would be the what? Semi-tendinosus. Yes. And then the muscle that's deep here is the semi-membranosus. Good. Okay, so let me take this off. We'll take the hamstrings off. So now let's move towards the muscles that are more medial, that are more towards midline. So the most medial one is this one here. This is known as the gracilis. Gracilis means slender. So it's a long, slender muscle here that goes down to the proximal medial tibia. Okay, so then if we still look at it from this point of view, from the medial side, this group that's deep to it, this is the adductor magnus group. So it's this muscle here and then this muscle here. Both of them make up the adductor magnus. So magnus means large, and then it's describing the action that it does, right? It adducts the leg or the hip. Okay, so then this muscle, number 26, this is known as the iliopsoas. So the iliopsoas is the convergence of the iliacus as well as the psoas major. So the iliacus is what's found on the iliac fossa, and then the psoas major is what's coming off of the transverse processes of the lumbar vertebrae. And so both of them are merging together at this point, forming the iliopsoas. So then this muscle that goes from here all the way down, it's shaped like an S. This is known as the sartorius. The sartorius inserts here on the proximal medial tibia. And so there are three muscles that attach here at the proximal medial tibia. So it's the sartorius, the gracilis, and then the hamstring muscle that I took off, which is the semitendinosus, the most medial one. So just remember SGT for the proximal medial tibia attachments. Okay, so I'm going to take the sartorius off. So we've identified adductor longus. So this was the adductor longus, this was the iliopsoas. And so if we look laterally here, this is what's known as the TFL, or the tensor fascia latae. So that's this here, it attaches here at the IT band, the iliotibial band. Okay, so now we're looking at it from a posterior view, and this muscle here is known as the gluteus medius. So the glute max was the one that was here, I took it off, so it's a bigger muscle. This one is the medius, it's a little bit smaller. You also have the minimus, but it's not shown here. But these muscles here that are found on the outside, the ones that I just mentioned, the TFL as well as the glute med, they're helping to abduct the hip. They're helping to bring it away from midline. Okay, so now let's look at the muscles that are up here at the top. So I've already identified this, the glute med, and then number 13, it's shaped like a pear. So this is what's known as the piriformis. And so if this muscle is tight, the piriformis, what it can do is it can pinch on the sciatic nerve. So this is the sciatic nerve that's traveling all the way down the leg. And so a good stretch, what you'll do is you kind of go in this position and stretch it out this way. You laterally rotate the hip. And so that brings me to my next point, which is these muscles here, which are the lateral hip rotators. So I'm not really concerned that you memorize all of these, but you do need to know that all of these lateral hip rotators, they attach here at the greater trochanter of the femur. Okay, so some of the lateral hip rotators include the gemellus superior, and then so that's 14. So I can bring that a little bit closer. So the gemellus superior, and then the gemellus inferior is here on the very bottom. So gemellus is Latin for twins, so they're pretty much like the same shape. So you have the gemellus superior and inferior, and then the one here in the middle, this is known as the obturator internus. Okay, and then this one that's here on the bottom, this is the quadratus femoris. So all of these muscles here are helping to laterally rotate the hip, and they all attach here on the greater trochanter of the femur. Okay, so we finished the muscles here in the upper leg. So now let's move on to the lower leg. And so the first one, the first bone that I'll point out is here. So this is the tibia. So this is the tibia. That would make this, because it's in the front, the tibialis anterior. So I'll bring this a little bit closer. So this is the tibialis anterior. And then this muscle goes to the digits, or the phalanges. So this is, and it's also in the front. So it's an extensor. So this is the extensor digitorum. So you have the extensor digitorum, which is here, and then 44, which is a little bit deep, that's the extensor hallucis longus. Okay, so I'm going to show you the flexor hallucis longus here in a little bit, but let's continue and work laterally. So the fibula is here. The head of the fibula is right here. That's where one of the hamstring, the biceps femoris long head is attaching, but this is the fibularis longus. So this is the longus, and then the brevis is the short one. So that's right here. So then now if we look at it laterally, so both of these are the gastrocnemius. So this is the lateral head, and the medial head is here. But the muscle that's deep to it, this is what's known as the soleus. So let me turn it this way now. So this is the lateral head of the gastroc. This is the medial head of the gastroc. I've already pointed out the soleus, and then if you take the gastroc off, so let me take the gastroc off. You can also see the soleus there. Okay, so we've done the front as well as the superficial deep muscles. So let me take this off. And let's look at the posterior side. So what we have here, so this is the fibula, and this muscle that's right here, this is the flexor hallucis longus. So earlier I pointed out the extensor hallucis longus, which was up here in the front. So that was this. So this is the extensor hallucis, and then this one is the back. In the back is the flexor hallucis. Okay, so then if we look at this muscle that's here, this is the flexor digitorum longus. So it's going to the phalanges. And number 40, which is here, this is the tibialis posterior. So you have the tibialis posterior, and then this muscle that unlocks the knee is known as the popliteus. Okay, so that'll do it for these, for the leg model. So now let's move on to the ligaments in the knee. Okay, so once again, what's the first thing I always do at a bony anatomy station? Orient yourself, right? Yeah, so we always orient ourselves. We want to know what we're looking at, the bones, the view, and everything. And so we know that this is the femur, this is the tibia, and this is the fibula. Okay, so let me take the patellar quadriceps tendon and the patellar tendon off. Okay. So the ligaments are just described based off using our anatomical terms, okay, directional terms. So I know that this is medial. This is the medial side because I look at the fibula. And so this ligament here is the medial collateral ligament. The one that's here on the outside, this would be the lateral collateral ligament. So then the ones that are here on the inside, so both of these are what we know as extracapsular ligaments. The ones that are on the inside are intracapsular ligaments. So this relates to once we were discussing about the synovial fluid and the components of it. So the ligament that's here in the front, this is the anterior cruciate ligament. And then on the back side, this is the posterior cruciate ligament. So make sure that you're keeping collateral and cruciate straight, that you're not mixing those up. Okay? So cruciate means like cross. Okay. So then I'll also point out here, this is the medial. Let me put this down. So this is the medial meniscus, and then this is the lateral meniscus. Do you remember what the meniscus, the type of tissue that it's composed of? Fibrocartilage. Great, excellent. Okay, so then a couple of other ones here. So this is the quadriceps tendon. This is where the quads go, and then they attach to the patella, which is right here, my pinky is. The patella, and then this here at the bottom, this is the patellar tendon, which is inserting on the tibial tuberosity. Okay, so now let's look at the ligaments, where they start and end, so their origin, insertion, and then what it is that they do. So for the MCL, it starts here on the distal medial femur, and then it inserts here on the proximal medial tibia, here on this side. Okay, so then for the LCL, it goes from the so the lateral distal femur, and then inserts on the proximal. This is actually just the head of the fibula. So yeah, the head of the fibula. So then if we look at the ACL, so the ACL actually starts here on the back side of the knee. So I know that this is the lateral condyle. So it's on the medial surface of the lateral condyle. And then it inserts in the front on the anterior tibial plateau. So here in the front. Plateau just means like flat. So the anterior tibial plateau. And then the PCL, which originates here on the lateral surface of the medial femoral condyle, right, because I look at where I'm at. And then it attaches on the posterior tibial plateau. Okay, so now we know the origin and insertion for these. What about the movements that they prevent? So the first one I'll go over is the ACL. Okay, this is like the most, or one of the, well, they're all clinically relevant, but this is a very popular injury that happens in sports quite a bit. And so what the ACL prevents is anterior translation, so movement forward of the tibia. So if I bring down the femur and then we can see the ACL, look at the laxity of, so just the tightness of the ligament. So whenever I bring the tibia forward, you'll see that it's tightening up that ligament. So the ACL is preventing anterior translation of the tibia. So one of the tests that they'll do is what's known as the Lachman's test. So they'll just grab the knee, just like I was doing earlier. They'll just grab the knee, you know, the patient will be seated, and then they'll kind of put their hand behind their leg, and then they'll just try to anteriorly translate the tibia. If obviously, if that ligament is ruptured, there's going to be a lot of movement there whenever they bring it forward. And so that's how they can, you know, rule someone out for, you know, hey, you can't go back in the game, you can't play because, you know, obviously they're going to be in a lot of pain, obviously too. So that's another thing. But yeah, so that's one of the tests that they'll do just to kind of like to check it before they do like imaging to see like the severity of the injury. But so that's the ACL, and then the PCL. If the ACL prevents anterior translation of the tibia, what would be the PCL? Because it's on the back side. Yeah, posterior translation. So if you look at it here and I bring it back this way, you'll see that the ligament is tightening up right there. Okay, so then the MCL and the LCL. So if we look at it this way, whenever I bring the tibia in this direction, so would this be away from midline? Is the tibia moving away from midline or towards midline? In this direction. Where is midline? Midline is here, right? Remember, look at the fibula. So it's abducting. So if you look at it, it's getting tight. So the MCL is preventing abduction of the tibia. So then if we look at it from this point of view, we have the LCL. So then if I move the tibia in this direction, right, it's tightening up once again. So the LCL is preventing adduction of the tibia. Okay. All right, so I'm just going to leave that there. All right, so that's going to do it for this lecture. Are there any questions?